Welcome to the OHSU Effect Inside Health and Science at OHSU, a brand new talk show here on KXL. I'm your host, Lacey Evans. Thank you so much for being with us on your Saturday morning. During the course of this program, we're going to introduce you to a lot of doctors up on the Hill and tell you about the different programs and research going on up there. Today, we're going to discuss obesity in adults and sports injuries in kids, among other things. Lots of topics to cover. And before all that, on our very first show, we want to talk to the president of OHSU himself, Dr. Joe Robertson. Good morning.
Good morning.
All right, tell us a little bit more about what listeners will hear on this show.
Well, we're very excited about what the listeners will hear. We think it's an opportunity for them to learn more about OHSU, and not just OHSU in general, but about how OHSU is improving the lives of Oregonians and how OHSU can impact the lives of your listeners and the lives of their families.
Yeah, I'm sure a lot of people are familiar with OHSU, the hospital, but they may not be familiar with OHSU's many other functions. So tell us a little bit about that.
You're absolutely right. OHSU is multifaceted. Besides our world-class healthcare, we have a large educational facility. We have a very extensive research program and also a lot of outreach programs to bring those services to people throughout the region.
What are you most proud of at OHSU?
I am most proud of the people at OHSU. They are there because they are committed to the mission and because they've specifically chosen to be there.
And I heard a stat like some 13,000 people work up there. Is that true?
We do. We have over 13,000 employees now. We've actually added 1,000 employees since the depth of the recent recession.
Wow. So OHSU is the state's only academic health center. So what does that mean? Explain it to us.
That means we have a large hospital that's combined with a large educational facility and also the large research program. We do between $300 and $400 million of research each year, and we train nearly 3,000 students in addition to having a large multi-specialty healthcare system.
So does that mean when you go there, what are the chances, I guess, of you getting a student doctor if you're going just as a patient?
When you come as a patient, you will always see a faculty provider, but you will probably encounter student learners. Those could be students, interns, residents, fellows. There are many different types. I'm very proud of that. I think those people add to the healthcare environment. They're young, they're inquisitive, they're very energetic, and I think because of them, the overall quality of care is better.
And I bet competition is tough to get into this school, huh?
It is very tough. For instance, in our School of Medicine, we receive between 3,000 and 4,000 applications each year for about 120 spots.
Wow. Oh, my gosh. I feel bad for the people that don't make it, but they have good careers elsewhere. So how do you see this radio show's role in furthering OHSU's work to improve the health and well-being of Oregonians? Well,
we can do our job better throughout the region if people understand who we are and what we do. And as I said, it's more than just healthcare. It's these other facets, and they are intertwined. When we're teaching, we're also collecting information that's relevant to research. All of those things are improving patient care. I think it's also the opportunity to get the message out about just how many services are at OHSU. We have over 1,000 providers. We have, if it relates to health or medical science, we have a specialist at OHSU that is world-class in that particular area.
Yeah, tell us more about those services, because there's several different branches, if you will, of OHSU. You know, you've got the Eye Institute and Dornbecker. So tell us about all those.
We have a major unit in almost every aspect of health that you can imagine. You mentioned some. Of course, some of our healthcare services that have gotten particular attention recently are in the areas of cancer and neuroscience. You mentioned ophthalmology or eye care service, Dornbecker, the Children's Hospital. We are making major impacts in the world of genetics, and as we move into the future, that's going to be increasingly important because therapies for every disease are going to be tailored to the individual and your genetic makeup.
Wow. And then, of course, the South Waterfront, that's kind of the newest construction zone, if you will.
Yes, and I'm glad you mentioned that because Of course, we have the Center for Health and Healing as the South Waterfront as we know it now, but this fall we will be breaking ground on a new building on the Schnitzer campus that's north next to the Markham Bridge, and it is a 675,000 square foot facility with a total cost approaching $300 million, and I think will be probably the largest academic building ever built in Oregon.
Wow. So a lot going on up there, to say the least. So tell us more about OHSU's role in educating healthcare providers. Tell us about your work in this area and why it's so important for the state.
Well, to get to the importance first, the real importance is that we have a shortage of healthcare providers, essentially all types. And as our patient population ages, we are going to need more and more providers, and we are, as a country, are not training enough. So we train all types of healthcare providers. We have schools of pharmacy, nursing, dentistry, and medicine. And as I said before, between 2,700 and 3,000 student learners of various types.
Which of those faculties, I guess, do you see being in the most need in the future?
I wish that I could. I wish that it were so simple that I could specify one, but it is every one. We train, for instance, with regard to physicians, we train just over half the number per capita that we should, according to national averages. And you can go through each of the schools and also find that Oregon is deficient in the total number of healthcare trainees.
Do you have partnerships with other universities around the state?
We do. We have multiple partnerships. For instance, our School of Pharmacy is a joint school with Oregon State University. We are working with OSU and PSU in our Masters of Public Health program. We have multiple programs, educational programs with PSU. We place students in other healthcare systems around the state, literally scores. We place students in rural communities in individual practices. So partnership is a very essential element of our educational plan.
What about doctors who are well out of medical school? How do you help them stay current with new technology, new research, stuff like that?
We offer thousands of hours of what's called continuing medical education credit each year. Some of those courses are given on site, some of them are given online, and some of them are given at other sites across the state.
So I think a lot of people out there might be, I don't want to say the word intimidated, but you know what I mean. They might view OHSU as a big research hospital and not really be aware that they can go there just for, checkups and other appointments. So how would someone get information like that if they're looking for a doctor?
You could call the general OHSU number, which is 494-8311, and they will be happy to direct you. I think it's important to remember that all care is ultimately delivered individual to individual, and the people at OHSU understand that and take that mission very, very seriously. So even though OHSU in total is very large and complex, the services are provided at the individual level.
So what are you most looking forward to hearing on this show?
I like to hear about each of the scientific areas and how that relates to advancing care for individual patients. At the end of the day, we're about improving the health and the well-being of our citizens. And everything we do at OHSU is directed at that. As I hear about the evolving and developing science, I get very excited because I look ahead and see what impact that will have on the healthcare of the individual.
And your background is in ophthalmology, right?
It is, and as an ophthalmologist and specifically as a retina specialist.
So are you going to make all the doctors down at the KCI Institute come on and talk about your passion?
I would love to do that.
Good. All right. Well, yes, we're going to have many different disciplines on. We have a pediatric diabetes specialist on, obesity specialist. We're going to talk about the Think First program, which is head safety, if you will, and the importance of wearing bike helmets. So we're going to cover it all here on the OHSU Effect, and we're glad that you could join us for this first show.
I'm delighted. Thank you very much.
Coming up later this hour on the OHSU Effect, Inside Health and Science at OHSU, we're going to talk to a doctor from the KCI Institute, specifically about kids and their eye health and what parents need to know to get ready for school checkups. Also, the warning signs that your child might be having eye problems. That's all coming up at 52 past the hour. And coming up in 13 minutes, minutes, we'll talk to the medical director of the OHSU Sports Medicine program. He's here to tell us about kids and injuries. They're playing so many sports these days, and we want to make sure to keep them healthy and safe. But first, in just 6 minutes, we're going to talk to an endocrinologist who is going to tell us about obesity in adults. He'll tell us about the causes and treatments and more about the complexity of the disease. Stay with us. Dr. John Purnell is coming up next on the OHSU Effect Inside Health and Science at OHSU. I'm Lacey Evans. This is News Radio 101 FM KXL.